Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our weekly update on COVID-19, both in the state of Maryland and at GBMC. The good news is that the number of people in Maryland's hospitals has continued to decline significantly. This is directly related to everyone's great work with washing their hands and keeping social distancing. Please keep it up. At GBMC, we really have not seen a significant change. We have 20 patients in the hospital who are COVID-19 positive, and we have another 20 who are awaiting test results. Testing continues to be an issue both at GBMC and in the state as we require more tests to do things like testing all patients prior to their having a procedure to make sure that we don't expose healthcare personnel to COVID-positive patients. So the testing will continue to be in the headlines as a need of the larger system. Thank you so much for responding to my request that this become a two-way conversation. We got 180 comments or questions after last week's video and requests for input. The GBMC communications team is reaching out to people who had very specific questions. Today, I want to address 5 areas. The first area that I want to address is visitation. Many of you were asking when GBMC would relax its no visitor policy. We have been allowing 1 visitor for women in labor, and that has created significant stresses on families that want to be with a woman who is laboring or to be there for the birth of a baby. I need to remind you that we are following the governor's phased-in plan. Although we realize that people want to be with their loved ones in the hospital, we still believe that it is too risky to have a lot of people who don't need to be here in the hospital. We don't want them bringing COVID-19 in, and we don't want the unlikely probability that somebody would come in and get COVID-19 in the hospital. So thank you so much for your understanding about our visitation policies. We will change the visitation policy as the governor moves us through to the next phases. The second topic I want to talk about is masks. I still believe that there's some confusion about the value of these ear loop masks. The reason why we are wearing these masks when we are in stores, at GBMC, at work, in our neighborhoods, is not to protect us. We are wearing these masks because we know that some people have COVID-19 before they have symptoms. And we are trying to protect people that we come across if we have COVID-19 and we don't yet know it. So thank you for covering both your nose and your mouth when you are out and about. If you are staying 6 feet away from others, it is likely that the mask is not providing any extra benefit. But since we all know when we go to pick up coffee in our favorite coffee shop, we may come within 6 feet of others. It's important that we're wearing the masks. Another topic I want to discuss is the overall risk of getting COVID-19. The background number, the number of people in our population that have COVID-19 is still pretty low. But again, we don't know who may be asymptomatic and not realize that they are COVID-19 positive. So there are two things we can do to protect ourselves. The first one is stay at least 6 feet away from others. Why? Because this virus is generally transmitted through respiratory droplets. As I am now speaking, there are some respiratory droplets coming out of my mouth. They are falling to the ground within about 3 feet of where I am sitting. So we add another 3 feet to be sure, and anyone at least 6 feet away from me will not get the virus. So that is why the 6 feet rule is important, and it's also why the mask is helpful, because it's blocking the respiratory particles if I sneeze, cough, or even just speak. How about safety at GBMC? We are working very, very hard to make sure that GBMC is as safe as it can possibly be. All of us, including myself, are checked every day when we arrive at work. Our temperature is taken, and we are asked to respond to questions about symptoms. We are all washing our hands frequently. All patients coming to the campus for elective procedures have already tested negative for COVID-19. And those 20 people that currently have COVID-19 are sequestered either in one of our inpatient units or, if they're sick enough, in the medical intensive care unit. There are no COVID-19 positive patients in other units. All of our nursing and clinical staff are wearing N95 masks, which are the masks that will protect you from getting the virus, and they're wearing face shields at every clinical interaction. So we have no evidence of transmission of COVID-19 at GBMC to patients. When we have a staff member who has symptoms, they are sent home after being tested, and they do not return to work unless they have a negative test and they have been symptom-free. So please, if you need care, you are safe at GBMC. The last broad category that I wanted to discuss is testing. You know that the nasal swab is the present gold standard test for COVID-19. The specimen is sent to the lab, and a PCR test is done looking for the virus. When it is positive, we declare that the patient has active COVID-19 disease, and we treat them accordingly. The other tests, the antibody tests, are from blood samples, and we believe they are not yet ready for diagnostic use. Why? Because the studies have not been done to tell us how much antibody do you need to have in your blood to assure us that you are immune. There will be more said about antibody tests as time goes on. Antibody tests are useful right now for epidemiologic studies of populations to determine just how many people are still susceptible. If you have been listening to my videos through the weeks, you will know that we believe that roughly 5% of Marylanders have been exposed to the virus. So still 95% of us or so are still susceptible. Now, the testing for COVID-19 via nasal swab is becoming more available, and there is excellent news this week. The state has begun doing contact tracing on all positive tests in the state of Maryland. This is important because short of having an immunization, the best way to reduce the rate of COVID-19 in our population is to find the people who are positive and then sequester them, quarantine them in their homes, and then identify the people they may have exposed, test those people, and quarantine them until we are sure that they don't have the disease as well. The state is using a telephone system using a national vendor, and that national vendor is then speaking with local health departments, and the local health departments will do further follow-up and contact tracing on specific cases. So I want to end, as I always do, by thanking you, the people of our community, for your excellent hand hygiene and social distancing. Please keep it up. And also, I must thank the fabulous healthcare workers, both at GBMC and in other healthcare systems, for treating those who have the disease, being there on the front line to keep the rest of us safe. Thank you very much.